So hello everyone, good morning everyone. I am John Ray Alolong, PSN 1B Henderson, and I'm the one who assigned to report about schistosomiasis. So this is my presentation, but before we start, let's have a 4-piece 1 read. So guess what were these 4 pictures? So we have 5 letter. That's correct. Fresh. Now, let's move to the next 4-piece 1 word. We have also 5 letter. Alright, water. So we have fresh water. Very good, very good. So schistosomiasis, and also known as snail fever, bilharzia, or Katayama fever. So, but let me know what is schistosomiasis. Schistosomiasis is tremorous from the genus Schistosoma, usually referred to as flatworms or flukes. So familiar naman kayo dito sa flatworms or flukes, ano? So nabanggit na ito ni ma'am na nung last discussion, like para siyang papel na ganun yung gilid ba? And flatworms, right? Flat. Okay, so let's move to the next. So next is schistosomiasis is the second most common tropical illness in the world, right after malaria. So bakit nga ba ito natawag na second most common tropical illness in the world? Itong schistosomiasis, and ang pinakauna is yung malaria. So kung may research kayo about malaria is na-research ko rin dito no. So ang malaria daw kasi is 1 billion yung naapektuhan niyang tao. 1 billion So itong schistosomiasis is tumatansya ng 251.4 million katao ang kailangan ng preventive treatment para dito sa schistosomiasis. So itong malaria is ang naapektuhan niyang countries is almost 100, but this schistosomiasis is almost 78 countries ang naapektuhan niya, kaya siya natawag na second most common tropical illness in the world. So yun and next is schistosomiasis is an acute and a chronic disease caused by parasitic worms. So yun almost lahat naman ng disease is nagkakaroon ng acute and chronic disease, right? So malalaman natin mamaya dito sa mga next slide natin kung bakit siya merong acute and chronic disease. So almost lahat naman ng disease is merong chronic and acute, right? So ang pinagkaiban lang nila is itong schistosomiasis is nag-cause nito is parasitic worm. Next is, yun na nga, nabanggit ko na kanina ito. Schistosomiasis transmission has been reported from 78 countries. Nabanggit ko na kanina to. So, bakit siya naging second most common tropical illness in the world? Kasi yung malaria is 100 countries ang kanyang apektuhan. But this schistosomiasis almost 78 countries. Kabilang na dito yung Philippines. So, ito, mga risk factors. Next is risk factors. Nakikita nyo dito sa my picture na yung mga bahay is dikit-dikit, and then yung kanilang water is almost infected water, right? Contaminated. Kasi nakikita nyo naman dito sa picture na merong mga tambak na basura, right? Kung tutuusin is doon nang gagaling din mismo yung mga kumbaga is naninirahan yung mga disease. So mga risk factors dito is mostly affect poor and rural communities. Still, lahat naman ng mga naapektuhan ng mga disease is yung mga may hirap, no? Pero meron din naman yung mga mayayaman, pero yung mga disease is walang pinipili talaga, no? Pero itong schistosomiasis is mostly poor and rural communities. Kumbaga, ito nasa picture. Ito nasa picture is mga poor mga poor people, kumbaga. Tulad na lang doon sa may Manila, nakikita naman natin doon so yung mga water nila is almost infected na kasi napagtatapunan ng mga basura, minsan doon sila dumudumi, minsan may umiihi, kaya yung tubig nila is mostly infected or contaminated. And also ang mga risk factors is women doing domestic chores in infested water, yun na nabanggit natin kanina, such as washing clothes, are also at risk and can develop female genital schistosomiasis. So itong mga female, kung bakit mga ano sila, mga risk factors ng mga women, mostly sila yung mga gumagawa ng mga yung mga naglalaban ng mga damit, mga ganun, ano, mga naglilinis ng mga gamit natin, right, no? So yung schistosomiasis, merong chance na dumikit sa skin nila, and then doon mag-develop yung schistosomiasis, and makaka-develop pa ng female na itong female na to is kumbaga sila pa yung napaparami. Next is inadequate hygiene and contact with infected water make children especially vulnerable to infection. So bakit nga ba vulnerable itong mga bata? So kung tutusin, nakikita ninyo or napapansin or naranasan na ninyo na mostly mga bata is mahilig magtampisaw sa mga tubig, right? So hindi ko naman na ikakailan na ako dati mahilig din ako maligo sa mga ganito, sa mga fresh water, like yung mga ilog, mga ganyan. Hindi naman natin alam, or ako lang, hindi ko naman alam na ganito or merong mga ganitong klase na pwedeng mangyari or whatsoever, mga ganun, ano. So nagtanong-tanong na rin ako sa mga classmates natin na ano, kung naliligo ba sila sa mga ganito, mga fresh water, mga ilog, mga ganyan, right? Next, urogenital schistosomiasis is also considered to be a risk factor for HIV infection, especially in women. So yun na nga, may classmate or may reporter, may previous reporter na nakapagsabi na yung HIV is mahina talaga ang kanilang immune system and madali silang kapitan ng mga disease, right? Itong kung bakit nasabi na especially in women, kumbaga kung may HIV yung woman, kung di ba sila yung mga mahilig maggawa ng mga maglaba, mga gano'n, magano sa ilog, maglinis, mga ganyan. So sila yung mga risk factor. Next, let's move to the causative agent. So what is the causative agent of schistosomiasis? Causative agent of schistosomiasis is the blood flux or the trematode sperm. So familiar naman ako dito, ano? So na-discuss na ito ni ma'am last discussion, right? So the schistosomiasis have two major forms of schistosomiasis, in our intestinal and in our urogenital. Next is schistosomiasis may localize in different parts of the body. So itong schistosomiasis is malalaman natin kung bakit naglo-localize sila in our different parts of our body. So we have 5 main species of blood fluke of schistosomiasis. We have here the Schistosoma mansoni and Schistosoma intercalatum, which cause in our intestinal schistosomiasis. Next is the Schistosoma japonicum and Schistosoma mekangi, cause the Asian form of intestinal schistosomiasis. And lastly, the Schistosoma hematobium, cause in our urinary schistosomiasis. So we have here the picture that pinapakita yung mga geographical distribution. Yun na nga, nasabi na natin yung kanilang location and their species. So, in our intestinal schistosomiasis, we have Schistosoma mansoni, nagkukos in our intestinal, and their geographical distribution, mostly nakatira or lumalaganap ito in the Africa, in the Middle East, in the Caribbean, and Brazil, and Venezuela, and in Suriname. And next species is the Schistosoma japonicum. Schistosoma japonicum. In their geographical distribution is in China, Indonesia, and here in the Philippines. And next species is Schistosoma mekangi. And their geographical distribution is in several districts of Cambodia and the Lao People's Democratic Republic. And last, in intestinal schistosomiasis is the Schistosoma intercalatum, which their geographical distribution is in rainforest areas of Central Africa. Lastly, the urogenital schistosomiasis. The species is Schistosoma hematobium, and their geographical distribution is in Africa and in the Middle East. Next, so we have here the pictures kung nakikita nyo or napapansin ninyo, yung isang bata dito na malaki ang tiyan, and nakikita ninyo dito na yung mga bata na naliligo doon sa may, hindi natin alam kung bahaba yan or ilog na talagang sadyang marumi. Nakikita nyo naman, ano? And then, yung braso na merong dots or mga pinagpasukan ng mga schistosomiasis. So, yun, ano? So, dito, makikita ninyo yung first picture, male and female schistosome. So, hulaan ninyo kung saan dyan yung male and female. Alright. Tama. So, makikita ninyo dito na male is yung malaki or yung medyo mataba-taba. And then, yung female is yung mahaba and then manipis. Right? So, and then, nakikita nyo dito sa second is yung paglaki ng tiyan. Right? Itong nakikita nyo. Kung familiar kayo doon sa may malnourished na bata, kumbaga ganun, ano? Di ba yung malnourished na bata is mapayat and then yung tiyan nila is mataba. Pero yung sa may malnourished is hindi siya cause ng nitong schistosome. Kumbaga ganun lang, parang ganun baga. Lalaki yung tiyan, kumbaga ganun. And then next is yun na, yung sa may kamay, yung sa may braso, yun ano. Nakikita nyo yung mga dots, yun. So, yun yung pinagpasukan ng schistosomiasis. Next is ito. So, dito, so, yun na nga, no, pinapakita dito na yung mga bata sobrang saya nang nilalaro or nagtatarampisaw dito sa may tubig. Fresh water yan, ano. So, yan, ano, makikita ninyo na marumi na, kumbaga is, yun. Kumbaga dito sa atin kumbaga is parang baha, ano. Next, dumako naman tayo dito sa mode of transmission. So, mode of transmission is exposed to contaminated fresh water when specific types of snails that are schistosomes carriers are present. So, yun na nga, dito. Magkakaroon tayo ng schistosomes kung na-expose tayo sa may contaminated fresh water. Yun na nga, especially yung mga bata, no, mga vulnerable, yung mga naliligo. So, yun, magkakaroon tayo ng schistosome kung tayo ay naligo sa mga contaminated water. At saka, kung meron doon yung snails na meron siyang schistosome or nagkikarry siya ng schistosome. Next is specific species of snails are present in the water, yun na nasabi ko kanina, when the eggs develop and the parasites grow and develop within the snails. So, yun, yung schistosomes, kumbaga, is nakadikit siya sa snails. Kumbaga, doon siya tumira. And then, kapag nag-grow siya, and then pupunta siya sa, so, the parasite escapes from the snail and enters the water where it can live for up to 48 hours. So, yun nga, no? Itong parasite nito is nakadikit siya sa may snails. And then, after nun, pag nag-grow na siya, pwede na siya mag-live doon sa may, sa may snails. And then, pupunta siya sa enters in the water or the fresh water, and they can live after almost 48 hours. So next is schistosome parasites may penetrate the skin of people who wade, swim, bath, or wash in contaminated water. So yun na nga, no? So nasabi natin kanina na yung kapag yung mga tao na naligo doon sa may contaminated water, magkakaroon sila ng nito or they can penetrate in our skin. So next, the worms grow inside the body's blood vessels and lay eggs within a few weeks, and some of these eggs pass through the bladder or intestines and end up in the urine or stool. So yun na nga, no? Yung worms is, they can penetrate in our skin, and then they pass through into our blood vessels, and then doon sila magpipisa sila ng itlog within a few weeks, and then itong itlog na to is pupunta in our bladder or intestines. Mag-end siya sa urine or stool, kumbaga doon sa may dumi na natin. Kaya yun. And then may chance na kapag yung tao or yung hayop is tumaid doon sa may fresh water, and then doon tutuloy yung kanilang life cycle. So next is, ito na nga, life cycle of schistosoma o schistosoma species. So as you can see here, yung una or yung first life cycle ng schistosomes is yung eggs sheds from infected human. So yung itong tao na infected, which is doon sa may kanyang dumi, nandoon yung present yung itlog ng schistosomes. Kung siya ay dumumi, like umihi or tumae doon sa may sa may water or fresh water, so yun, ano. And then the second nun, kapag yung tao is nailabas niya na itong dumi, yung itlog na yun is magpipisa or mag-hatch, the eggs hatch and release miracidia. And then after nun, kapag pumisa na yun, ayun, so maghahanap siya ng intermediate host. Kung yung intermediate host niya is yung snail. So yun, no, kapag nakahanap na siya ng snail, which is pupunta siya doon, yung miracidia is they penetrate in snail tissue. So yun, didikit siya doon, ano, so doon, ano, after nun sa 3 stages, which is yung dumikit na siya, and then yung schistosomes is magiging spore cyst na, yung na-develop niya, magiging yun, yung umaga nag-grow is ang tawag din is spore cyst. And then after nun, yung spore cyst na yun is pwede na siyang umalis dun sa may snail, and pwede na siyang lumangoy-langoy dun sa may fresh water, which is they can live over 48 hours, no. After nun, yung schistosomes na yun, itong kapag di ba lumalangoy-langoy niya sa fresh water, and then kapag may tao na naglangoy-langoy or naglaba or basta na direct contact dun sa may fresh water na yun, and then yung ano na yun, yung cercary na yun is magpe-penetrate into our skin. And after nun, yung pag naka-penetrate na siya sa skin natin, and then yung cercary na yun lost tails during penetration and become schistosomulae, yung tawag doon, schistosomulae, which is yung ulo niya na lang. So natanggal na yung yung tails niya. Parang baga yung sa may sperm natin, yung di ba familiar ay nakita niyo naman na kung paano lumaw yung sperm papunta doon sa may egg nung babae, ano. So kapag yung pumasok na yun, and then yung ulo lang yung papasok, and then yung tails is mawawala. Like parang ganun yung procedure nitong life cycle nitong schistosome. And after nun, magsi-circulate na siya, pupunta sa ating migration to portal blood in liver and maturation into adults. Yun, so magiging adults na siya, no. So magkakaroon na siya ng male and female schistosome, which is yung pinakita ko kanina doon sa previous slides natin. And then paired adult worms migrate to A, B, and saka C, which is yung A is Mansoni, ay Japonicum or Mekonji, and the B is Mansoni, and the C is Hematodium. So yun, ano. So nag-develop na siya into adult, and then mag-create ulit sila na mag-lay eggs, and then pupunta ulit sa may urine or stool, sa may dumi ng tao, and then kapag yung tao is dumumi or umihi ulit, yun, paulit-ulit ang life cycle ng schistosome. Next is, so ito pa nga, life cycle, ulitin natin. So dito, so life cycle, site of inhabitation, the portal vein system, mainly in the inferior or mesenteric vein. So yun, dun sila nakatira. And then the infective stage, sa infective stage is cercaria, which is yung sa may yung lumalangoy-langoy na siya dun sa may fresh water, yun yung infective stage niya. And then the infective rot, which is yung ating skin, dun sila pumapasok. And then intermediate host, yun na nga, yung Oncomilania snail, yung una nilang pinagbabahayan, which is yung snail, ano. And then reservoir host, which is the mammals such as buffalo, cattle, wild rodents, goat, monkeys, pigs, fox, and etc. And then syempre yung tao. And then eggs are main pathogenic factor. They are inlaid in the liver and intestinal wall. Some of them are discharged in feces to complete in life cycle. Yun, so yun na nga, nasabi na natin kanina. Para makomplete yung life cycle nila, which is pupunta sila sa may intestinal or urogenital. Tapos mag-stay sila doon sa may dumi kapag nailabas, and then mag-hatch, and then yun, patuloy lang yung life cycle. And then the development in the human body requires in 25 to 30 days. So kapag na-infect ka, kapag naligo ka sa contaminated water, so development nito is umaabot siya ng isang buwan. So next, pathogenesis na tayo, no? So unusual due to eggs not total clones. And itong schistosomes has 3 phases: migratory from the time of penetration until maturity egg production. And symptomless dito, wala pa masyadong symptom na nakikita, no? So meron pa siyang acute and chronic. So malalaman natin yan mamaya sa may next slides natin. Next is sa acute phase. So dito na sa acute phase, dito na magkakaroon na yung taong infected ng Katayama fever. And symptoms include chills and fever. Yun na nga, magkakaroon tayo ng lalamig at saka lagnat, ano? So fatigue, yun, ano? So lymphadenopathy, which is yung enlargement or yung paglaki. And then many eggs are carried by the hepatic portal circulation back to the liver. So next is the chronic disease naman tayo. Chronic phase. So yan, ano, magkakaroon tayo ng endemic areas or asymptomatic intestinal. Sa intestinal natin, so magkakaroon ng mild, chronic, or bloody diarrhea. So familiar na kayo dito, ano? So yung pagtatae ng merong dugo. And then abdominal pain, pananakit ng tiyan. And then lethargy. Schistosomiasis hematopia. Pain on urination and blood in urine. So yun, ano, pananakit kapag umiihi. So familiar kayo sa may UTI. So yung UTI is parang ganito, ano, kapag umiihi is yung masakit kapag umiihi. Pero itong UTI, which is hindi naman siya cause nitong schistosome, kumbaga parang similarity lang, ganun, ano. Tapos yung pag-ihi is meron dugo. And 8% of cases of infection of Schistosome japonicum and Schistosoma mansoni, development of egg, granulomas, and fibrosis in the liver seriously impedes portal blood flow and enlargement of the spleen. Yun, ano, yung nabanggit na natin kanina, no, yung paglaki ng tiyan. Yung pinakita natin kanina doon sa may picture, no, yung paglaki ng tiyan. So yun, yung example ng enlargement of the spleen. Next is genesis. Schistosome japonicum tend to involve the small intestinal, which the brain more often, brain lesions, and the schistosome hematobium is the least serious. Pain is most intense at the end of urination, cause bladder cancer evidence by NMJ and MND. And next is the clinical manifestations. The immediate manifestations of schistosomes is cause skin reaction in the form of rash. So yun, nabanggit na natin kanina sa may picture, ano, sa may braso na merong dots, which is yung karoon siya ng rash sa pinagpasukan ng schistosome. So yun yung immediate manifestations. And the next is the acute schistosomiasis manifestations, which is takes up to 14 to 84 days for symptoms to appear and caused through contact with infected water. So yun, kapag contact ka na sa infected water or contaminated water na merong schistosomes, which is within 14 to 84 days, mag-a-appear na yung mga symptoms. And then, this chronic schistosomiasis manifestations occurs when eggs have hatched in the immune system. So yun, ano, itong chronic is kapag meron ng itlog dun sa may ating dumi. So yun. And next is mga symptoms. Dito na tayo sa mga symptoms, ano. So yung characteristics nitong schistosomes, which is ayun na nga, nabanggit ulit natin kanina, a raised rash at the site of entry of the worm. So yun, sa may braso. Kanina yung picture natin. And common is, itong mga common symptoms is yun, fever nga, yun, yung lagnat. And then, next is yung body pain, yun nga, yung pananakit ng katawan. And mga common sa may ating digestive system, which is yung bloody diarrhea, yung abdominal pain, and anemia. And in genitourinary system, which is yung irritation in the bladder. So yun ano. And then pain during urination and sexual intercourse. Yun, nabanggit naman na natin kanina. Yung pananakit ng pag-ihi. Tsaka also yung sexual intercourse. So pag-ipagtarik sa may partner ko ba yun. And the frequent urination. Ouch! Ito, masakit talaga, no? So frequent urination. Tapos masakit may pag-ihi. Talagang or masakit talaga. Kaya seriously serious. And blood in urine. So yun, kapag iihi ka pa, frequent urination, masakit, and then meron pang dugo. Next is, so ito na, other symptoms sa heart and lungs naman. So yun, wheezing, shortness of breath, ayun, so yung shortness of breath and persistent cough. Nakikita nyo naman dito sa picture. Ano? And then, in our brain or in our nervous system, which is headache, dizziness, and seizure. So, let's move to the next slide, which is the laboratory diagnosis. And laboratory diagnosis is the doctor first performs a physical exam and reviews patient history. And the doctor asks questions about recent activities involving exposure to fresh water. So, yun ano, nasabi na dito, no? Next is the microscopic examination. So yun, the stool and urine samples are examined under the microscope to identify parasite eggs. So, ayun ko po sila ng tae or ng ihi mo, and then they can examine under the microscope kung titignan nila kung merong parasite na nagkukos talaga ng disease. And then the antibody test, the blood sample is used to detect antibodies against the parasite. So next is the treatment. The treatment includes antiparasitic medication. So yun ano, dito itong praziquantel is a prescription medication is taken for 1 to 2 days to treat infections caused by all schistosome species. So dito meron tayo ditong feature ng specific treatment, ano, infection drug of choice, adult dose and duration of blood flux. Itong schistosome mansoni and intercalatum and hematobium ang tinuturok dito. Ito pa lang praziquantel is yung injection, ano, tinuturok. So ang kailangan kapag itong species na to na kumbaga is nag-cause itong tatlo na to, kailangan natin ng 20 mg na tsaka 2 doses in a day. Dapat kailangan 2 turok, ano. Kapag ito naman Japonicum or Maikangi is kailangan is 3 dose in a day, in 1 day, ano. Let's move to the prevention. Now, this is yung sa kung paano natin ma-prevent itong tinatawag na disease na schistosome, no? So avoid swimming in fresh water. So yun, avoid swimming in fresh water, mostly in contaminated water. So wag tayo maliligo sa may sa ilog or sa fresh water or sa may basta fresh water na contaminated. Possible na merong schistosome or other disease doon sa may contaminated water na yon. And swimming in pools with chlorinated water is safer. So bakit nga ba nasabi dito na itong pools with chlorinated is mas safer kaysa sa may fresh water na wala? So yun ano, kasi hindi sila pwedeng tumira doon sa chlorine, sa mayroong chlorine, kasi talaga naman itong chlorine is nagpapalinis ng tubig, ano. So kung napapansin niyo yung ating faucet, which is minsan nilalagay talaga merong chlorine, so para talaga malinis. And then itong yung sa dagat din, so wala doon, ano, walang parasite na pwedeng tumira doon. So hindi sila pwedeng tumira doon. So fresh water lang talaga sila pwedeng tumira. And then prevention is also drink clean. Tama naman talaga, no? So pero meron yung iba is yung sa may Africa, ano. So wala talaga silang wala talaga silang masyadong malinis na tubig. And inom tayo ng boiled water. So the larvae can enter in through your lips. So hindi sila mag-enter kumbaga kapag nilunok ba, swallowing, hindi sila enter diretso sa may ating they can pasok-pasok here in our lips. So yun, kaya dapat kailangan is uminom ng drink clean and boiled water. And also, see your doctor for appropriate diagnosis and dapat wag na natin patagalin, kumbaga. Yun. Next is, alright, the references. If you want to check or if you want to more info, so i-paste and then i-search sa my Google Chrome. So yun lang naman ako, And thank you for listening. That's all.